In March of 2010, President Barack Obama enacted the Affordable Care Act, also known as Obamacare, in an effort to make health insurance more affordable and more accessible to all Americans. By the time Obama came into office, using legislation to improve access to health care wasn't a new idea. The earliest form of private health insurance emerged in the late 1800s as industrial sickness funds, giving payments to dues-paying members who were forced out of work due to illness or injury. By the beginning of the 20th century, many European nations had enacted healthcare programs. Progressives in the United States sought a similar program with their candidate Theodore Roosevelt in 1912, but he lost the presidential election that year. In the 1930s, FDR passed the Social Security Act, which gave government payments to people who had to stop working due to illness or injury. In 1944, Congress passed the Veterans Readjustment Act, which expanded public health care to many millions of ex-service members after World War II. In the 1960s, Lyndon B. Johnson signed Medicare and Medicaid into law, and the government began providing subsidized health care to elderly and low-income Americans, respectively. Other presidents, including Harry Truman in the 1940s, Richard Nixon in the early 70s, and Bill Clinton in the 1990s, tried to pass health care reform, but private insurers feared that government-subsidized insurance would impinge on their business. When Barack Obama became president in 2009, 45 million Americans were uninsured. A growing number of American employers had cut health insurance from their benefits. The growing costs of medical care became a lead cause for personal bankruptcies, foreclosures, and family crises. So, the new president made healthcare reform his chief mission. In February 2009, just 1 month after his inauguration, Obama delivered a speech to Congress announcing his administration's push for reform. Even though Obama and his fellow Democrats controlled Congress and the White House, the reform efforts were delayed as members of Congress debated how much of a role the government should have in health care. After many compromises, the ACA finally made it through Congress, and Obama signed the law in 2010. The immediate goals of the ACA were to make health insurance available to more people, while also making healthcare cheaper and expanding the Medicaid program, though only some states opted into that expansion. To put the ACA to work, the federal government created a healthcare marketplace, which is a service that allows Americans to shop for and enroll in affordable health insurance. The ACA also created government standards for minimum services that must be covered by private insurance plans and stopped private insurance from denying or charging people more based on pre-existing health conditions. In 2014, an individual mandate went into effect, which required Americans to pay a penalty if they decided not to buy a health insurance plan. Through these provisions, the ACA managed to achieve many of Obama's goals. By 2016, nearly 20 million previously uninsured people had acquired health care. Despite that accomplishment, some have criticized Obamacare for the individual mandate penalty and the government regulation of what they see as a private industry. By 2014, Republicans in the House of Representatives had already voted more than 50 times to repeal the measure, only to be blocked by the Senate each time. Obama's successor, President Donald Trump, campaigned on repealing Obamacare and signed an executive order to allow the sale of cheaper health insurance policies with fewer benefits. He also signed a tax bill that repealed the individual mandate clause. While the debate continues over the best methods of increasing American access to health care, the ACA remains a pivotal piece of legislation in our history.